Mothers are like glue. Even when you can't see them, they're still holding the family and keeping them together. Welcome to Journey to Motherhood. Good evening to you, wherever you're watching Bethany TV from. I'm Teacher Zita. Today's show, we bring you Sophie, Teacher Sophie. She has a lot to tell you as far as this topic is concerned. Today is Saturday and it's a Journey to Motherhood. As usual, this show is about motherhood. We talk about pregnancy related issues. Mothers call in, mothers share the experiences. We listen to the different opinion from the experts and we keep it a journey. Welcome to the show. I'm Teacher Zita. Let's put our hands together to welcome Sophie as our mother of today to tell us something about the topic that we're going to look at. Sophie, good evening.
Good evening, Teacher Zita.
Welcome to the show.
Thank you so much.
Nice seeing you here.
Very nice meeting you.
Please say hello to the mothers who are listening and want to hear your experience.
Hello, mothers out there. I'm Teacher Sophie. I also use Kahandire Sophie. I'm glad to be here tonight.
Okay.
I would like to share my experience. The journey to motherhood.
Thank you.
It has been a good thing.
Okay.
Yes.
Thank you so much. Our topic for today is miscarriage, Sophie. Yes, and before we look at it, kindly tell us your experience as a mother. How was the beginning? How was the end? What are the good things you've gone through? What are the worst moments? What are those things you feel like, oh, I will never do this if I'm to become a mother again? Tell us your experience.
Thank you, Teacher Zita. My journey to motherhood was not really planned. Since I was a child, I wanted to become a mother at an old adult age.
Okay.
I never wanted to be a young mother, so I had to look into that. I made sure that I complete studies. I started working. So by the time I became a mother, I really didn't plan for that, but it came in and I was ready.
Okay.
I embraced it. It was so nice.
Okay.
And the journey started like that.
Okay.
So first I started giving birth to babies and it was a good experience.
Thank you. What are those trying moments that you went through during that time when you were having all those children?
The trying moments, you know, when you're not used to such things, there's a way your body changes and you start feeling weak, the morning sickness.
Morning sickness, that annoying sickness.
Yeah, the annoying sickness, you don't feel good. Then you start losing the commitment at work, that is if you're working. You start performing less at work. You have to be at the hospital for some time and then, so you try to balance things, but things don't really work out well like the way you used to do. But you cope up as time goes on, you get used to becoming a mother, then you start getting babies.
Especially after the first experience.
Yeah, exactly.
You learn something.
The first experience is always terrible. You need to learn everything. You don't know how to breastfeed. Even the labor pains, you don't know how they are. You just have to learn each and everything.
Thank you. What are the good things that you feel like, wow, I think I should give birth each and every year?
Yeah, the good things, actually that's how I even ended up giving birth on a yearly basis. I could feel good when I'm pregnant. My husband could always be by my side, could always comfort me. I could always feel like an angel. Please don't do this, be careful, do this. I could really like that. And
so if you're not expecting, it doesn't do that?
Exactly.
Oh, really?
So whenever you could go for antenatal, he's like, please let me come pick you, go for lunch. It makes you feel so good and you're like, I should get another.
every year.
Exactly.
Thank you so much, Sophie, for that wonderful and brief experience you'll share with us. Today we're looking at miscarriage as our topic. Yes. Have you ever had one?
Yeah.
When was that?
It was exactly after my firstborn. I conceived. I didn't know I had conceived because I conceived 3 months after producing.
The first child?
The first child.
Okay.
So I didn't know I was going to conceive, but abruptly I conceived and I wasn't aware. And in that process, you know, I was still a young mother.
How old were you by then?
I produced at 27 years.
That is your first child?
Yeah.
Okay. And then the second one came in?
The second one came in. I wasn't aware. I only had...
How old was the baby by then, the firstborn, when you conceived the second child?
The firstborn was 3 months.
3 months old?
Yeah.
So after giving birth, did you start your normal menstruation as immediately? Because some mothers even take a year.
Yeah.
Yours, you got it immediately?
Immediately,
okay.
on my very first month.
Okay.
I started my periods and then I conceived. I wasn't sure, but as time went on, I actually got to know when it was too late. I fell sick, and when I went to the nearby hospital, they gave me some drugs. They were telling me it was an infection.
What drugs did you take?
I took some antibiotics.
You don't remember the name?
I don't remember the name.
Okay, okay.
But it was a strong antibiotic. So when it came in, when I took it, I got a miscarriage there and then. I didn't know why. Maybe the thing was serious, the sickness, so I didn't know about it. I took it, but it was from a clinic, so I was rushed to a hospital. I went to Chisui Hospital.
Did they know that you were expecting?
Yeah.
No, as they were giving you that antibiotic, did they know you were expecting a baby?
Yes, I told them. But it was a clinic, a nearby clinic. So I think, I don't know, because when I came in with my husband, was like, please give her the best medicine. So they gave me the strong antibiotics. After taking it, I started feeling abdominal pain, and then spotting started, so I was rushed to Chisui Hospital. Okay. Reaching there, I went for scan, and they told me it was a miscarriage.
Sorry about that.
Yeah.
And how about the second time?
The second time, it still occurred. That was after my second born. I wanted to...
How long did you take to conceive after this first miscarriage?
I still conceived immediately after. I think after 1 month.
After 1 month?
I conceived.
And the firstborn baby was around 4 or 5 months?
Yes, exactly. Around 5 to 6.
Okay.
I conceived my second child.
Okay. So what happened in that process?
I produced the second baby, and then again immediately, I think I was too fertile. That's what they told me, because I could conceive anytime I could. And then
you had a peace of mind. First of all, you wanted a lot of comfort.
Exactly.
That time that someone consoles you, so you were all relaxed.
I was enjoying the whole thing.
I think so.
Yeah. So I conceived again, and then, but this miscarriage came in, I think it was within the first 2 weeks.
Did you know that you had conceived also?
No, this time I didn't know. I didn't know. I just saw, actually, it was some slight pain, abdominal slight pain. And
you didn't get any fever, any infection, any malaria?
Nothing.
Nothing, just abdominal pain.
Abdominal pain. And when I went to the hospital, they told me I needed to get a bed rest. Okay. Because by that time when I conceived the second child, I wanted to go back and work.
Okay.
Because all this process, I could miss going to work, I stay home, so I wanted to resume my work, and it was hectic. You need to handle things at home, leave the baby home, then rush to work, and then I had 2 of them. I got another one. It was abrupt.
It was very challenging.
Yeah.
Let's look at the first pregnancy. Could it have been the first miscarriage? Could it have been the medication that you were given that caused it, or it was the infection?
It was the infection.
Did they explain to you from the hospital, from the clinic?
Yes.
What could have caused that? What kind of infection was it?
It was a UTI.
It was a UTI infection. So they were trying to treat the UTI.
Yes, they were trying to treat it, but they told me it was a serious infection, and maybe I went for the medication when it was too late.
Too late. Sorry. And then the second one, did they tell you the cause?
The second one, they told me I had a lot of fatigue. I was doing a lot of work. So I needed a bed rest. And immediately after, that's when I stopped working for some years.
Oh, and then you stayed home to take care of the children. Yeah. How old were the kids by then?
The kids, one was 1 year, 1.5. Then the second one was around 6 months. Yeah.
So after the 6 month, after raising these children, did you conceive immediately again? Or after the last miscarriage? Or you took some time before you got another baby?
Yeah, it took some time.
Okay.
But it wasn't long. I only took 1 year. Then I conceived again.
Okay. Did you go through some counseling sessions, some support from the medics, from home, or from someone? How did you manage it? How did you handle all those? Because one thing with miscarriage, when you have it, you get a little traumatized. You get worried, thinking also the next pregnancy, I might lose it. Yes. How did you handle your situation?
I had a gynecologist. I had my gynecologist, so I could always visit the hospital, could always talk to me. And by that time, those miscarriages, I was yearning for a girl. I had produced boys. And so I thought maybe those babies of mine were girls. I could feel bad, and I was like, now if I produce again and get a boy, I was feeling that kind of, but my husband was there for me. My doctor could always talk to me, and some other counselors. My sisters are also medics. Okay. So they gave me some support, and I went through it well.
Thank you so much, Sophie. In case you're watching us, this is Bethan TV, and it's a journey to motherhood. We have Sophie, a mother, a teacher, and a business lady. She's sharing with us her experience as far as miscarriages are concerned. Let's look at some early signs of miscarriages in pregnancy, especially to a first-time mother who does not know anything about it. One, you can experience bleeding from the vaginal area, or spotting, bleeding or spotting, which can be light or heavy with a lot of pain. So when you get such symptoms or signs as a mother, first of all, you're already expecting. Why would you get abdominal pain? Why would you get spotting? Why would you get bleeding? Make sure you take precautions by going to the hospital immediately. Two, cramping, that kind of pain, that constant. For example, when you're in your periods, there's a way you feel those cramps, they're too much, they're tense. So when you are expecting, especially in the first trimester, and you experience such kind of lower abdominal pain, watch out. It could be a cause, it could be a sign, it could be a warning signal that something not right is happening in between you. And then fluids, blood clots or tissue passing from the vaginal area, as well as that, can also be a warning sign that a miscarriage could be on the way. And these days it's very common. And according to research, miscarriage normally happen between 20 to 23 weeks of pregnancy. That is always the first trimester. And causes are very, very many, especially in the young mothers of today. You can be having a lot of stress, you can be doing this and that, not knowing that it can affect your body. So you can be part of this show by sending us your experiences on our WhatsApp pages, and the numbers we're running on the screen, and you tell us how you handled your miscarriage during that time when you were expecting. Sophie, did you get any support treatment from the doctors? Because I was talking to a mother sometimes back who got a miscarriage, and she's like, every time I conceive, I get so worried. I think because I think after the miscarriage, she was treated. I don't know what kind of treatment she got, but she told me she was cleaned, something like that, so that the womb was able at least now to contain another baby in there. What was your experience? Did you get any cleaning? Did you get any treatment? Did you get any massage? Any kind of medical support you got?
Actually, I did not get any treatment because mine could occur during the first 2 weeks, and the whole thing could come out could see the spotting, then bleeding, and it could not even be so painful. So I never got any treatment, not even cleaning, because whenever I could go to the scan, they could tell me it's a complete abortion.
It's a complete abortion, complete miscarriage.
Yeah.
Okay.
So it could always be.
So very clear.
Yeah.
During this time, what kind of advice was given to your husband? Because when the baby is young, couldn't you go for family planning, or couldn't you plan to stop something like that from happening?
I actually wanted to. There's a time I even started taking pills, but unfortunately I conceived.
When you were taking pills?
Yes.
Or you didn't take them properly?
I don't know, maybe because I was still a young mother, but I swallowed them. But
how were you swallowing them?
The pills, I could take one per day.
One per day. Were you taking it at the same time, the same interval?
I was taking it at night.
The same time? Because according to medical doctors, if you want to regulate the pregnancy and take care of your body very well, you should mind about the time. If you're taking it at 8, it should be at 8.
Yeah.
If it's 9, how were you taking yours?
I was taking it at Around 10, when I was going to sleep.
But still you conceived?
Yes, I conceived.
And did you seek for any medical explanation about that? Because one thing I know, when you're on family planning, you do not conceive.
Yeah. I also wondered maybe it was not timely, but I remember I swallowed. Immediately after I conceived. Like even my first child, that's how I conceived. I thought I was still breastfeeding and the baby was still young, but I still conceived early.
You still conceived even despite the fact that you were taking medication?
Yes, I swallowed, but I conceived. So I just planned to produce and then stop at once.
Thank you. Let's talk about the challenges of miscarriage. When you get a miscarriage as a mother, there is a way at times you feel, there is a way at times you get demoralized. What challenges did you meet as a mother when you lost all those 2 pregnancies?
Yeah, it's traumatic.
No criticism, no what? Can you share with us something small about that?
There were no criticisms because I didn't disclose it to many people. And the good thing with it, I could conceive immediately after. So I could always feel, I couldn't feel the loss of the baby so much because I could always add on another one. And then I could always have support, and when I'm looking, maybe I yearn for a girl and he's like, you never mind, maybe this one is a baby girl. So I did not feel so challenged.
Okay. And your husband was okay with it?
Yeah, he was okay with it.
So now, this other baby that you conceived, the last child that you have, is that your last born, or are you still planning to bring it more?
She's my last born.
That's your last born. You no longer want the care? That tender loving care that you get?
I always don't want to think about it because I'll end up going back to producing.
Oh, you'll end up going back to producing when you think about that?
Yeah.
Okay, that is very good. Let's look at a few things that you can do to avoid miscarriages when you are a young mother or a mother, in case it happens, and in case you want to avoid it. These are some of the few things that you can look at. One, look at your health habits, your lifestyle. If you're using drugs, just like Sophie was telling us, self-medication at times is not very easy and not very good for you as a mother when you're expecting. Avoid using drugs that you're not sure of. For example, there are certain drugs that you can take as painkillers but might not be very good for you as a mother, especially when you're expecting. Use of things like cocaine, yes, it might really affect you, especially before the 20th week of your pregnancy, that is in the first trimester. So that can as well give you some warning, warning signs that you are likely to have this or that. Then also alcohol. Alcohol is also not very healthy when you're a mother and expecting. It can as well cause you some problems when you're expecting, especially in the first trimester. Nutrition and a balanced diet, yes, this can as well help you when you are a mother, especially when you've just conceived. Eat well. There are certain foods that you can avoid. For example, in the first trimester, foods like a pineapple. Yes, according to medics, last week when we were talking to doctor, was telling us to avoid eating a pineapple, especially when you're still before the 20th week during of your pregnancy. Such foods can as well give you or cause you some problems. Infections are also a leading cause of miscarriages in mothers because of the different body changes, the different bacteria that the body can be trying to fight. At the same time, the body is trying to keep safe the baby. It can cause a lot of, differences in between a baby and the mother, and before you know it, you are getting a miscarriage in life. So those are some of the habits that you can avoid, or things that you should avoid as a mother to avoid miscarriages. Because of late, it is so common. I was talking to a mother, and she was sharing with us. She has said every time she conceives and she eats raw pineapple, she loses her baby. So I think it could also be adding on something, just like we said. And like when you eat a healthy diet, especially which is recommended by a professional, it can help you to live a very good and have a healthy pregnancy. Sophie, back to you. When we talk about miscarriages, most mothers tend to, the moment you get it, honestly, there's a way you feel. There's a way you feel. You start blaming yourself. You start looking here, there. According to you, what can mothers do in life when especially they cannot use family planning, they cannot take care of themselves well, and they're expecting? What can you advise them to do, owing to your experience?
Actually, all mothers need to take good care of themselves, especially during the time of pregnancy, because it's so delicate, it's so tricky. Any slight mistake can make you lose your baby. So we need to, like, from my own experience, the sicknesses, like you talked about, the personal hygiene, we need to mind so much about the personal hygiene. We need to eat well, we need to sleep, get enough rest. You don't need to work so much, you know, you don't need to do a lot of work, hard work. Yeah, you need to mind about your body, because you're carrying some other baby inside, and the baby also needs to rest, and when you overwork, the baby is also being overworked.
Thank you. It's still Bethan TV. We're going to have a very short break. Please stay with us. We're coming back for more. Welcome back from that break. It's still a journey to motherhood on Bethan TV. Teacher Zita, together with Sophie Kahangire, she's telling us and explaining to us her experience as a young mother who happened to experience 2 different miscarriages due to a few circumstances that she could not avoid. In case you're following us, our WhatsApp numbers and phone numbers are going to be available. You can share with us, send us a text, and give us your experience, because this show is all about motherhood. In this show, we experience many things, we share many things, we consult, and we encourage each other, because motherhood is not something very easy. So when you have a miscarriage, in case you have any miscarriage as a mother, please do not blame yourself. It's not your fault, and never will it be your fault. There are some of the things in motherhood that we cannot avoid as mothers. Welcome back to the show. Sophie, how long did you bleed during this miscarriage process? For the first one, let's start with the first child.
Okay, the first child. It started with a spot.
Okay. How long did the spotting take?
It was just it was a day.
Okay.
Spotted for a day. Then the next day.
Were the spots big with clots?
No, they were not
just
big.
Little?
Yeah, just little. Then the next day, I started bleeding. And the bleeding was quite heavy.
Okay.
Not like the normal bleeding.
Okay, okay.
It was not normal. That's when I thought of, I think it's a miscarriage. And when I started bleeding, of course it was my first miscarriage. I didn't know what to do. I had to rush to the washroom. So immediately when I was there, a big tissue came out.
A big clot?
A big clot, yeah.
That very same day? How long was the bleeding?
The bleeding was heavy. It started, it could not contain the pad. You could not put something. That's when I rushed to the washroom. When I was there, I felt something dropping. And when I saw it, I was scared. I even took a phone. I got a phone, I took a photo. I was like, what is this? I didn't know it was a miscarriage. I didn't know how it looked like. So from there, that's when I went to the hospital.
After the clot, did the bleeding stop?
No.
It continued for how long?
It continued for like 2 days.
Did you feel any dizziness?
Of course, the dizziness was there. And the doctor and my gynecologist told me to drink a lot and eat some fruits, because the bleeding is heavy. It comes when it is heavy. It's not controllable. So by the time I went to the scan, they told me the other, the thing which dropped, that was it. It was a complete miscarriage.
It came out completely?
Yeah, it came out completely. Okay. Because it was still in the early stages.
How many weeks did you say they were by then?
They were around, it was coming to a month.
It was coming to a month. Okay, and then the second one, how many days did you bleed? The second one, what were the early signs that you started feeling?
The early signs, it was an abdominal pain.
Was it so severe? The cramping, yeah. Yes, the cramping.
I felt them and I was like, now what? I was pregnant.
Did you take any medication, painkillers?
No, this time I did not take. because it was, the cramping came because I was working a lot. I had to go to work. Then my maid, I remember, had gone. So you go to work and then come back home. You need to do domestic work. I started feeling the cramping. Then the backache. That is how it started. Then the bleeding started. And this time I was aware, I knew it was a miscarriage.
Okay.
Yeah.
And then the bleeding took only a day or two?
Yeah, like 2 to 3 days.
Was the bleeding also heavy?
This time it wasn't that heavy.
You could control it?
Yeah.
How old was the fetus by then?
It was 2 weeks.
Only 2 weeks. And after all that...
Because this time I did not see something big come.
No clot?
No clot.
No big tissue came out? And how long did you rest?
It's during that time when I started resting. I stopped working. I stayed home, started taking care of my little baby and myself. And then I got a nanny and started staying home. What
are the things that you were told to avoid when you were resting, while you were resting?
They told me to avoid overworking, because I told them I never had a nanny by that time. Told me you need to rest, you need to eat well, observe your eating habits, eat on time. I had some time to rest, could just be home, do some little work, and then take care of myself and my baby.
Okay, thank you. That was something very critical, and I'm sure you handled it well. Now let's look at the different types of miscarriages. There are quite many, but these are some of the most recent, that are most recurrent and very common among us women. There is complete, just like Sophie was saying. That complete means the baby, the blood flows out and then the tissue comes out. You don't need any cleaning, you don't need any tissue removal from the medics. It's completely out. You become normal apart from the bleeding. Then there is incomplete. Incomplete is, this is when some other parts come out, some other parts keep in there, and then in that case it becomes a little problematic to you as a mother. There the doctors need to take some other precautions, they need to take some other means of removing the remaining tissue from the area where the baby was formed. Then we also have ectopic. Ectopic is not a very simple one. This is when, according to medicine, medical health workers, this is when I think an egg is fertilized in the tube instead of the right place where the baby is supposed to be formed. And in most cases, when it goes into the tubes, it becomes also another severe story for a mother and experience. So at times it ruptures, at times the tubes rupture, and then at times it comes out, or at times they need to also take another measure to remove the pregnancy. And then there is recurrent. Recurrent, this is when you have it, then again it comes. It could be caused by a medical, maybe health condition, it could be maybe genetical, or it could be stress, it could be self-medication, it could be any other infection that keeps on bringing it. So above all these, you need to always find out why you are getting recurrent miscarriages, and then you take precautions, prepare your body, have enough rest so that you avoid it. And then there's also molar. Molar is when actually the baby is conceived, and then from nowhere the genetical formation and everything inside there turns and changes, and then it looks like some meat, some potato kind of look, some flesh, but the human formation completely changes. Those are some of the few types of miscarriages that mothers always have and go through. So this is something that we need to know as mothers for a journey to when you're attending this show. In case you want to be part of our show, please, you can send us your messages on WhatsApp and share with us what happens. In case you had any miscarriage, you share with us how you handled it, and tell us what could have caused it. Our numbers are running on. Please be part of the show as you share with us, as we listen to Sophie Kahangire through her journey to motherhood. This is Bethany TV. Sophie, are there some foods that the doctors could have advised you to avoid next time in case you're planning to conceive?
Yeah, there are some foods. Actually, they could tell me the best foods to eat, the fruits, the veggies, then they tell you what you should avoid.
Like, for example?
Like if you're, for the foods, actually, they could tell me about the drinks, those who drink.
Drinks like which one?
Alcohol. Then the wine, the smoking, bit of it. If you're smoking, they tell you, please.
You need to stop.
You need to stop. And then use of drugs. They tell you don't use that because maybe it's not healthy for the baby. Then they tell you at least eat fresh foods. Eat the proteins, the bodybuilding foods, because some, like you just said, some babies lack the building blocks. True. You become pregnant, and those chromosomes, they don't really develop well. The genetics don't match, and then you find yourself getting a miscarriage. Okay.
Is there any history of miscarriage in your family?
It has been happening to one of my sisters.
To one of your sisters? And at what stage did it happen?
It could also happen in the early stages.
How about in your background, from your mother's side or father's side? Have you ever found out if any of you, if any of the relatives could have had anything like miscarriages?
It's not common, not really common. Actually, I've been hearing my sister, the one who also lost 2, who got 2 miscarriages, also in the early stages.
Okay.
Yeah.
Thank you. Our lines are running, and the WhatsApp messages can be sent on those numbers 0786-050762 in case you want to be part of our show. I have a message coming in direct from a mother. She's saying, "Good evening, Chazita. My name is Harriet. I got 3 different miscarriages, and one of the cause the doctor told me was stress. I think she was stressed a lot. Yeah. Yes, I got a lot of stress. Every time I would conceive, I would go through a lot of financial difficulties. So it would definitely worry me. And in the process, I feel dizzy, and immediately I start bleeding and get a miscarriage." Sorry about that, Harriet. Another mother, she's saying, "Good evening, Teacher Zita. My name is Sarah. I got a miscarriage last week, and I think it's because of UTI. However, I'm trying to treat the infection and it's not going. I don't know how it can be helped. Sorry about that." Let's talk about UTI, Sophie. You treated UTI during that time when you had a miscarriage. Then after, what happened? Because by then you were now breastfeeding the baby. Did you get the UTI after birth, giving birth to the first baby, or before giving birth? Because this is the same thing Sarah is going through. First, she's saying she's treating it, but the UTI seems not to be going. Yes.
I developed a UTI when I was pregnant.
With the baby?
With the baby.
Not the first child who was 3 months old?
Yeah.
Okay, okay.
And that's what led to the first miscarriage, because it was, they told me it was, and how do they say, it wasn't slight. It was like, it was severe. It was severe.
The UTI.
Yeah. So even by the time I came to the doctor, to the clinic, giving me the medicine, that thing was severe on me. So I had to get a miscarriage.
Sorry.
But immediately after, it was treated. And when you take good care of yourself, you observe the washrooms where you go and everything, you cannot get such.
But were you working by then, by the time you got the UTI?
I was
working. Could you have got it from the workplace or from home?
I think so.
Okay. Oh, sorry about that.
From the workplace.
Thank you. Another message from Tina. Tina is saying, "Good evening, Teacher Zita. I'm watching you right from Entebbe," and she's saying, "Thanks so much for the show. I got a miscarriage last year, twice, and I lost hope of conceiving again. Maybe, God willing, I'll be there." Tina, thanks so much for your message, and Harriet and all of you who are sending in messages directly. One thing you should know is that don't blame yourself for a miscarriage. It could be a factor that, an underlying factor that you could not even be aware of. It could be something that you cannot even control as a mother. Secondly, it happens not only to you, but to many mothers. So when you get such an experience, don't give up. Don't feel like, oh, this is the end of my journey. You can still have a positive thought, go through some counseling sessions, and above all, find out what is causing that recurrent miscarriage. It could be something simple or something really very severe that you need to follow up and treat up before you conceive again. Otherwise, please take heart. You're not the first. Okay, there are many mothers who are battling out there. Sophie's telling us what she has gone through. So please take heart and continue on conceiving. And but before you conceive, please prepare yourself. Find out the real cause of the miscarriage so that it helps you to plan better and have another child. I have another message from Brian. Brian is saying, good evening, Chazita. My wife got a miscarriage but totally failed to conceive again. What could it be? Sorry about that, Brian. Doctor will maybe get to us, but according to the little knowledge that I have, before your wife conceives again, perhaps there could be some other things that should be treated and handled. Please, you need to first go to the gynae. You need to go to the hospital, find out exactly what could be happening. So don't give up, don't feel offended. Many things happen in pregnancies. That is why Bethany TV is here, to give us all that we need to know about our body. So thank you so much, Brian. Another message is coming in this is, she didn't put her name. Good evening, Teacher Zita. How can I handle miscarriages in our family? My sisters have miscarriages, but I'm married and I'm worried I might as well get the same. Please don't worry. There is no name here. Your condition might be different from your sisters, and what can affect your sister might not affect you. So please feel free and get onto the plan of conceiving. Hello, thank you for the show. I am Alice Bira and I had a miscarriage at 5 months. It's now 1 month since. I'm happy that my friend Sophie, who took care of me while at hospital, is on the show. This is Bira, Alice?
Yeah.
Yes, wow, that is good. Thank you so much, Bira, wherever you're watching from. Sophie's here. She has got the courage to come and share with us, because in most cases we mothers, we fear talking, we fear saying something, and then we keep it for ourselves. Yeah. But this, I'm so happy that you came in, Sophie. You've encouraged many mothers there. You've told them things that they should know as they prepare their bodies to conceive, and as they prepare their bodies in case of a miscarriage. Another one is saying, good evening, Chazita. I have had three of miscarriages, which the causes was not really explained. The last 2 really left me discouraged. This is Janet. Janet, take heart. So sorry about that, Janet. Take heart. You shouldn't give up, just like Sophie was telling us. Please find out why you are getting those recurrent miscarriages. Do not give up. It's very hard to treat what you don't know, and it's very hard to handle what you don't know. So if you find out that you've gone through this, if you're nearby Kampala, you can come to Bethany Hospital, Women Hospital in Luzira. There's another branch in Entebbe, and the doctors can handle you. Or if you're far away, you can seek medical guidance from professionals. They can help you and prepare your body to conceive again. Sophie, we are still talking about your experience.
Yeah.
Yes. Are you planning to have any child? You said you're not planning to have any babies?
Yeah, I'm not planning.
Yes. Bida is saying you took care of her. I don't know what had happened. I think she had got a miscarriage at 5 months. Wow, yeah. This is a little traumatizing. That is, I think, now stillbirth, because the miscarriage is always before the 20th week. Yes, the 20th week of pregnancy. So if it's this is a stillbirth. It could have also been caused by something that you should really find out and be in the know. I have another message here coming direct from a friend watching still. She's saying, good evening, Teacher Zita. Thank you so much for the show. My name is Rosette. Rosette from, she didn't put where she's coming from. If I treat UTI and during pregnancy, will it cause miscarriage? This is something a little complex, but if you're having UTI, before you take in any medication, please make sure you do it with the right precaution and guidance from the medical doctors, because as an expectant mother, there are some drugs or there are some medications that we are not supposed to use, especially when we're expecting. So if you have UTI, please seek for medical guidance, seek for support from the professionals before you subscribe or you describe anything for yourself to take in. Please take care of yourself and avoid self-medication. This is Ronald. Ronald is saying, good evening, Chazita. Ronald from Gayaza. My wife had a miscarriage, and up to now she has still failed to conceive. It was an ectopic, yes, an ectopic pregnancy. Sorry about that, Ronald. Just like we've said, miscarriages can be caused by different things in life, different conditions in life, different infections, different lifestyles. You can never know what could have caused it. Failing to conceive is another call that directly is telling you to take another step to find out what could be blocking her. If she's still very young, unfortunately, didn't indicate the age, but if she's still a young girl, or maybe also age, please, you need to seek for medical guidance. They can find out exactly what it could be. It could have been maybe an incomplete miscarriage, and there could be some particles still remaining in there that needs to be perhaps extracted out before you prepare herself. She prepares herself to conceive. So that is what I can tell you, Ronald. Another person is, good evening, dear. I'm Gladys. I got a miscarriage last year at 12 weeks. And it was due to severe fever and stress. Sorry, Gladys. After recovery, the doctor advised me to start taking folic. And I believe God this time round, I have to get a bouncing baby. Thank you so much, Gladys. This is very interesting. Wherever you're watching Bethany TV from, please follow the medical guidance that the doctors are telling you. And in most cases, we avoid taking folic acid. Just like the doctor was telling us last week. Folic acid helps the babies to, that fetus, that blood circulation, growth and development is always got a lot from folic acid. So when you abscond from swallowing, from taking it, you are endangering the child's life indirectly. Thank you, Gladys. Please, we wish you well. God willingly, you will have that bouncing baby. Hello, Bethan. My name is Susan. I'm 21 years old. I got a miscarriage last year. The pregnancy was 3 months, but the doctor told me that it was an empty sac. What could have been the cause? So sorry, Susan. Doctor will answer all these questions in the next session. Unfortunately, he's not here, but he will answer all these questions. It's not very easy for me as Teacher Zita to explain what could have happened. If they're saying it was an empty sac, there could be a medical condition or an underlying condition that you could not know. Neither could I know, but only the experts can tell you this. This is still Bethany TV. And it's a journey to motherhood. We're looking at miscarriages. Mothers are sharing their different experiences. Mothers are giving in their opinions. Fathers are also coming in. And for you, the men who are watching outside there, thanks so much for making us proud mothers. Because without you as men, the mothers would have not been able to have all the children. Thank you so much for the support. All the men, gentlemen who are sending in messages, please continue taking care of the women, especially when they're expecting, because it's a very trying period. Some of them can be first-time mothers. They don't know what to do. They don't know how to do it. So when you are there as a team, there's a way the journey becomes a little simpler.
Yeah.
Yes, there's a way the journey becomes a little simpler. This one is Susan. She's telling us that her sac was empty. I don't know what could have caused it, but doctor will be able to explain to us more in detail. I have another message coming in here from Jenny. Jenny is saying, thank you so much, Teacher Zita. Thank you for the program and for the show. I'm enjoying. I think I've learned more. And next time, I'll also do the same. And advise my sister who got a miscarriage to listen to your piece of advice. Thank you so much, Jenny. We have another message in here coming in from, didn't put the name. Good evening. Thanks a lot for the show. A pregnant mother with a history of miscarriages should avoid eating apples, grapes, and pineapples. Thank you. This is also a good piece of advice because some of the fruits, as we stated, and according to doctor's explanation last week, there are certain fruits that we should avoid, especially in the first trimester, because they can trigger, they could be having some sap that could not be very compatible with the baby. So these can as well like entice the miscarriage to occur and take place. Otherwise, thank you so much. It's still a journey to motherhood. I'm Teacher Zita together with Sophie. Thank you so much for sharing with us. Thank you so much for being with us. This show normally happens and runs every Saturday from 9 to 10, where we host a mother and they give us their different experiences. You can follow us on Facebook, on YouTube, Bethany TV Uganda, on X, Twitter. You'll always find us there and give us the comments. Your viewership, your comments, your calls give us a boost, gives us life, give us more hope and more, more confidence to run and continue with this show. Thank you so much for being a part of the show. I have another message from, this is James. James is saying, good evening, Teacher Zita. I've tried calling, but the number is not going through. I've heard a lot about miscarriage. My sister got married some months back. She got the first baby and got a miscarriage at 3 months. The second baby again. Immediate after the miscarriage, she conceived and got another miscarriage. Oh dear, sorry about that, James. What could it be? James, it could be a little tricky, just like we were saying. You need to find out what the real cause of a miscarriage could have been, because at times you might not be knowing what it could be. And the other thing is that the husband of her husband should as well take precautions and take a step to go and find out from the medical workers what could have been wrong or what could be going with her body, what could be happening with her body, so that at least if there's any cause, the doctors can handle it. Sorry about that, James. We pray and hope that she settles and gets a baby. I have another message coming in from Benjamin. Good evening. My name is Benjamin. I and my wife are going to do a scan, and they told us that she has fibroids. And one of the fibroids is sitting on the IUD and cannot come out, but she's so stressed. Sorry about that, Benjamin. Sorry about the situation that you are facing with your wife. The doctor will as well give us another answer to this. I'll keep these messages. We are very sorry. Doctor has not been able to be with us, but he's watching live and is going to give us all these answers that we need towards these questions the next time we are going to sit with him. Benjamin, fibroids is one of the leading cause of miscarriages, especially in the early stages. But if it's sitting and it's not affecting the baby, kindly keep monitoring, because I've seen many mothers who get fibroids but they end up giving birth without operation, because by that time they cannot do any operation, any surgery on a pregnant mother. You cannot remove the fibroids, neither can you remove the baby. So at times the fibroid grows alongside the baby, and then in the end she gives birth. She shouldn't worry, she shouldn't get stressed. Let her keep on doing some exercises, balancing her diet, as well as getting guidance from the doctors. She will be better, God willingly. Thank you. Good evening. Doctor is not in the studio. One of our senders saying, good evening, doctor. Me, I have been swallowing the UTI tablets without knowing that I am pregnant. Doctor, will that tablet affect my baby? So sorry, it's not easy to tell what kind of UTI that you have. I'm Teacher Zita, I'm not the doctor, but I'm trying to answer a few of these questions according to my experience and the little research and knowledge that I know about pregnancy, infections, and other things that are related. It's very hard to know the type of UTI that you have. Perhaps, maybe it could even be a vaginal infection or a urinary tract infection. So it might not be easy for us to tell and explain to you whether the tablet will affect the baby or not. However, as we said, avoid self-medication. Go to the hospital, go to a professional, and you see how best they can help you to carry on with this pregnancy. Otherwise, self-medication is very dangerous, especially when you're expecting a baby. This is still a journey to motherhood. We are almost closing. Thank you so much for being a part of this show. Please join us again next week on Saturday, and we look at ectopic pregnancy next week as our topic. Sophie,
yes,
thanks so much for being with us.
You're very welcome.
Please encourage the mothers who are there, who have gone through this, and they feel discouraged. They feel like they can never conceive again. Give them some word of encouragement.
Please, mothers out there, feel free. Miscarriages happen to any other woman.
True.
It's not only to you. Any person can get it, and most of the women are getting miscarriages before even they get to know about it. It just happens all of a sudden without even anything, and you get a miscarriage. Because there are so many things. We look at the stress, look at the hard work, we look at the financial challenges, we look at the UTIs, everything. There are so many things, the drugs, the foods we take. So we just have to be careful about our health. Let's love our body, mostly the mothers. Have the love for your body, the personal hygiene. Take good care of your body. Monitor the places you go to, the washrooms.
Especially the public places.
Yeah, especially the public places. Monitor them. Take good care of your body, and make sure you conceive when you have a healthy body, a healthy mind, so that you carry the baby, and the baby will also be healthy. You'll produce healthy babies, and you'll feel good about it.
Thank you so much, Sophie.
You're very welcome.
In case you've had any miscarriage, please take heart. You can still balance your mind and conceive a very healthy baby. But above all, seek medical help. Watch out your habits, your lifestyle, and prepare your mind that you are about to conceive and have another baby. From the team, we are going to sign out and wish you a very good night. See you tomorrow as we look at another topic. We are going to have it in Medical Minds with Dr. Annaba tomorrow at 8 p.m. here at Bethan TV. Thanks so much for being with us. From the team, we sign out.